Hello, I am Pharmacist Virginia, and in this video we are going to look at what is inside a Dressit Sterile Dressing Pack. So you turn it over, and on the side you can open the flap without any scissors, so it's easy to just tear it, and then inside you'll find this sterile dressing pack. You can throw away the packaging, and if you are preparing a sterile field, then you want to make sure you only touch the outside until you put the gloves on, which are in the inside. So the gloves in here are green, and I'm just going to pick them up and put them on, so then everything else I touch will still be sterile. So you put on the gloves one glove at a time, and of course you will have washed your hands before you open the sterile dressing pack. So now I'm putting on the other glove on my left hand, and this pack has medium to large gloves, and there is a small to medium Dressit pack as well. You will also find a piece of paper which has a ruler in centimetres so that you can measure the size of the wound, and there is also a pain guide which has smiley faces so that you can ask the patient to point to the smiley face which matches how they are feeling. So on the right you have number 10, worst possible pain. Then you have number 8, very severe pain. Number 6, severe pain. Number 4, moderate pain. Number 2, mild pain. And 0, no pain. So the no pain, 0 on the scale, shows a happy smiley face, and the worst possible pain has a sad crying face. So this is helpful if you have a patient or person that you are treating that does not speak English, because they can point to the face which can describe the type of pain that they are feeling. There is also an apron which is folded, and that is sterile in the pack, and it has a hole for your head and neck to go through so you can dress it over your body, and it also has these 2 handles that you can wrap around your body to wear the apron. There is also a bin bag that you can use, and the bin bag has a strip which is sticky, and you use this bag to put all of the waste inside. And if you take the protector off the sticky bit, then you can stick the bag somewhere, maybe onto a table, or you can take the whole thing off in order to close the bag once you have put all of the waste that you want to get rid of inside it. So I'm just removing all of the plastic protector to stick the bag closed. There is also some sterile tissue inside the bag, and you can use this to place near the wound area. And there is also some sterile gauze swabs, which are the same as the ones that you can buy in the pharmacy in a packet. And there is a wound dressing pad with a blue line on one side and nothing on the other side. And you place this dressing pad onto the person's wound to absorb any blood or anything else that might be coming out of the wound. You will need something to keep this wound dressing pad in place, so something like tape or a stretch bandage. And there is also a tray inside the pack, and you can use that to capture any sterile saline fluid that you use to wash the wound with before you put a new dressing on, or you can use it to dip the sterile gauze into the sterile saline water, which is sterile salt water that you use for washing wounds. And then on the side you'll also have some other dressings that you can use that you bring with you. So wound dressings that are either sticky, so they'll say adhesive or self-adhesive small dressing, or whichever size they are, the right size for the wound. So that's where that ruler on that piece of paper comes in handy, so you know you're putting on the right size dressing. And there are some wound dressings which do not have sticky edges, so you might need to use a stretch support bandage to go around it, or you might need to use some tape to keep it in place. So this is a stretch support bandage, which I will show in another video. And then there are different types of tape, like zinc oxide tape and also paper surgical tape. So the paper one being better for more sensitive skin. And this is another type of bandage, a Crepe bandage, that you might want to use to secure the wound dressing in place. So I hope you enjoyed this video, and I'll see you at the next one. Thank you so much for watching.